introduction?
Yeah, we're gonna do
Okay.
an introduction.
Thank you.
You're welcome.
Okay, good morning, everyone. Good morning. So, I'll wait till everyone is giving me their undivided attention. All right, so good morning, everyone. So as you see, we have another speaker series today. Aren't you excited?
Yeah.
So before we get started, we're gonna have Fanny introduce our speaker today. So remember, make sure. Yes, clap for Fanny. So just a reminder, make sure your iPads and your phones are put away. You want to be respectful to our speakers, correct? All right. Go ahead.
So this is Miss Dr. Elizabeth Marashi. That's right. Okay. She attended Juniata College in Huntington, Pennsylvania as a psychology major.
Physiology.
Physiology.
Yeah.
Physiology, that was my bad. One of her duties is to be responsible for primary care for her patients. And her salary range is a minimum of $100,000. Her qualifications is a medical degree, complete, I don't know how to say that, and a state license, and serve as a resident doctor. Give her a round of
Good morning. Thanks for your attention in advance, everyone. Thank you to the Deans for having me. So I'm an emergency room doctor, and I've been practicing for 20 years, and yes, thank you for that. And so I prepared a little lecture about what I do in the emergency room, and then I'm going to talk to you guys about sort of the road to get to the ER, like how do you become an ER doctor. So I'm going to just start with a little story. So when I was a sophomore in high school, so you guys are all freshmen, right? I decided I wanted to become a doctor. And so I very proudly told my parents, guess what? You know what? I want to become a doctor. And I thought they were going to be so proud of me. Wow, that's such a great profession. But no, my dad says, a doctor? That means 4 years of college, 4 years of medical school, and then training after that. You're going to be an old lady by the time you're done. When are you going to get married? When are you going to have kids? And I thought, oh my God, really? So anyway, I completely ignored him and carried on. And he quickly came around and was very supportive of my decision to become a doctor. But in his defense, he didn't go to college. My mom didn't go to college either. He immigrated to this country when he was 20, so he didn't even know really what United States college was like. My mom was one of 10 kids, so and actually her first language was Spanish. She's Mexican American, and so she didn't learn English until she started school. And so for my parents, college and med school, graduate school, it just was not on their radar. And so I forgive them for that. So the moral of the story is that if you tell your parents you want to go to med school and they say, "What, are you crazy?" Just ignore their career advice. And they will come around, because when they get older, believe me, they will call you for free medical advice. I get that all the time. So now my parents are super happy I'm a doctor because I'm giving all kinds of free medical advice, not just to them, but to other family members. So how many of you want to become a doctor? Come on, let's see some hands. Let's see some hands. Yes, good. Well, hopefully, after I talk to you a little bit about what I do, hopefully some more hands will go up. Oops. So, how many of you have ever been to an emergency room? Ever? Okay, I figured that'd be
Unfortunately.
So hopefully you weren't there as a patient, hopefully you were just touring or maybe visiting a family member or something. So I'm just going to start with telling you about, how the emergency room doctor approaches a patient. I'll talk to you a little bit about what we see in the ER, and then again I'll talk to you about how to get there. So the first thing we do is we take a history and a physical. Anybody can come to the emergency room. It's a law in this country, thank God it's a law, that you don't have to have insurance, you don't have to have any money, so anyone can come to the emergency room for any reason. You cannot turn anyone away. So the approach to the patient is the same with every single patient, so we follow this sort of protocol. You take a history, you do a physical exam, you initiate treatment, somebody tripped and fell, they're in pain, you start some pain medication. If they come in for other things that are scary, you order blood tests, and then in some patients you order some imaging studies. Oh my gosh, what is happening? Somebody's hacked into my computer. Oh! Yeah. Much more exciting. Way more interesting. Look at that.
Put the Oh yeah, it's that one.
Yeah, the second we go back on, probably one of the kids has got the password and is just booting us off. And with their
So
thing.
anyway, for example, so this person has a bad wrist fracture, right? So this is actually normal. That's a growth plate, so that's normal. These are growth plates. Those are normal. This obviously is not. So you take your history, what happened? Oh, I tripped and fell on an outstretched hand. You do your physical exam. You can see that there's an obvious deformity. Here's their arm, and then it kind of goes like that. So you can see that it's obviously broken. You're going to give them some pain medication right away. That's very painful. You're not going to order any blood tests on this kind of patient, but you're definitely going to get an x-ray. So you get your x-ray, you're like, okay, yeah, that's broken. I think everybody can see that. So then you need to actually push it back into place, right? Because it's dislocated. Well, it's displaced. So then you do your diagnosis, broken wrist. You do your treatment. You need to push on those bones. So you're going to give that patient some anesthesia, completely knock them out to push on the bones, and then replace the bones to where they need to be. So here's a before, and here's an after. So this bone that was previously like that is back where it needs to be, and then this one too is back up, and you can see now the arm's nice and straight, which is the way it should be. And then you put a splint on there, and then you send the patient off to an orthopedic specialist. So the emergency room doctor is responsible for everything from the time they come in, treating the problem, and then you pass this patient on to an orthopedic surgeon who will then put the patient in a cast and take care of it, not today, but actually in a few days from now. So you've completely taken care of the patient, and then you pass the baton on to the specialist, which is what we often do. We pass the baton to the specialist depending on what the patient has. So we're just going to run through another quick case here, which is a trauma patient, unfortunately. So again, you run through this protocol. Every patient gets it. They do an initial assessment, which includes your history and physical. You get some blood test imaging studies. You make a diagnosis, and then depending on your diagnosis, you come up with a treatment plan and a disposition for the patient. So this unfortunate young lady, she's 18, driving her car and lost control of her car. She wasn't wearing her seatbelt, so her head smashed into the windshield. So she just, fortunately for her, just has an isolated head injury. So you get the history from her. A lot of times paramedics will help you with the history. You can see she obviously has an injury to her head. Because this is a bad trauma, you're going to order some blood tests, and then you are going to order this CAT scan. So this is her brain, right? Here's the brain, the skull. This is sort of normal part of the brain, and this right here is a lot of bleeding, and that's called an epidural hematoma. And that blood is actually pushing down all the brain. It's causing swelling of the brain. And I don't know if you can see, there's supposed to be a ventricle here, but it's completely obliterated, that ventricle. So that needs to be drained. So you call your friend, the neurosurgeon, and say, I have this injury. They take the patient promptly to the operating room and drain this blood out of their head. if you're working in the middle of nowhere and there is no neurosurgeon, it's actually within the scope of practice for an emergency room doctor to take a drill and actually drill through the skull and release the pressure, which is life-saving. And then you put that patient either in an ambulance or a helicopter and helicopter them to the closest hospital that actually has a neurosurgeon, who would then definitively take care of that problem, get the bleeding to stop. And I actually did one of these. It's called a burr hole. I actually did one of these when I was a medical student. It was fun. If you're a doctor, it's fun. Take my word for it. So what do ER doctors do and what do we see? We see everything. Anything that you can imagine or even things that are beyond your imagination, I'm telling you right now, we have seen it in the emergency room. So you have to know how to treat every emergent thing within all the different specialties. That doesn't mean you're an expert obstetrician or gynecologist, but you need to know the emergent things within gynecology, orthopedics, etc. Teamwork is extremely important. We're not working in a bubble. I'm not the only person. I rely on my nurses. I rely on other doctors from other specialties to help me. We have technicians that help clean wounds. They do our EKGs. They help get patients blankets, and these are all really important things. And so teamwork is really, really important. ER doctors, we work shifts, so we're not 9 to 5, Monday through Friday. We do not have banker's hours. And the shifts will be anywhere from 8 to 12 hours. And if you think about it, the ER is open, every single day, right? All night long. So that means that ER doctors are there throughout the day and night. So sometimes you're working night shifts, sometimes you're working evening shifts. When I was young and single, I used to work 12-hour shifts, and I would work 3 12-hour shifts a week because that's full-time, actually, and so I'd have 4 days off in a row. And sometimes I was able to make my schedule such that I would have 4 days off in a row and then tack on another couple days, so I would actually have like a week off, and so I'd go travel or do some things. So it really allows you to have a lot of flexibility with your schedule. It's really a wonderful career in that way. And yeah, so ER doctors work weekends and holidays. Now what we don't do, a lot of people have this misconception that we're doing the surgery or that ER doctors are taking these trauma patients up to the OR. We don't do that. We rely on our specialists to do that. So if a patient comes in with a major trauma, they're bleeding internally, they have some damage to the liver or something, we would do everything up until they need to go to the operating room. So we would initially see the patient, we would order all the diagnostics, we'd start the treatment, we'd get them stabilized, and then we call our friend the the trauma surgeon. The trauma surgeon would come down, and then they take that patient off to the operating room and definitively fix the problem. Somebody comes in, they have an appendicitis, same thing. We make the diagnosis, which is actually the most challenging part, in my opinion, and start the treatment, give them antibiotics, pain medication, then we call the surgeon and say, hey, I have a patient with an appendicitis. They just come down, take the patient up to the operating room, take the appendix out. We don't do C-sections, although we do deliver babies. I was a year out of my residency, working in the ER. I was by myself, and the paramedics call and they say, oh, we're en route to the hospital with a woman, she's in labor, and we can see the baby's head, she's crowning. It's just when you can sort of see the hair. And so we thought, okay, no big deal. You know, usually we send these patients straight up to the labor and delivery floor and they have their babies, no problem. And so a few minutes later, this paramedic comes like rushing, I need a doctor in the ambulance bay. And you know, remember, I'm a new doctor, so it kind of took me a minute to realize he was talking about me. And I kind of looked around, and I was like, oh my God, he's talking, that's me. And so the charge nurse and I, we grabbed this birth pack. It has all the things that you need to deliver a baby. And so we run out to the ambulance bay, and the doors are open, and you see this lady, her legs are wide open, and you see a baby's head coming out. So, you know, you very calmly jump into the back of the ambulance, because even though you're screaming inside and freaking out, you have to show the patient that you totally have this. And you say, okay, with your next contraction, I want you to push really hard. And the baby's head was purple. So I am literally internally freaking out. And so she had her next contraction, pulled the baby out, pinked up, baby cried, cut the umbilical cord, take the lady inside the ER, delivered the placenta, called OB, and they're like, wow, great job. What do you need me for? And I said, yeah, exactly. So we get to do exciting things. So now there are some realities of emergency medicine. You know, there are a lot of TV shows about the ER and how exciting it is, and all these beautiful people work in the emergency room, and it's actually not quite like that. So, you know, patients coming to the ER with trauma are actually in the minority, and that's going to vary depending on where you work. If you're working at County USC Medical Center, you're working at Cook County Hospital, which is one of the busiest hospitals in the country, you will see a lot of trauma. It will be kind of crazy all the time, but generally speaking, even if you're working at a trauma center, you're only going to see a handful of traumas a day, and in between that, you're going to be seeing stuff that's not quite as exciting. You know, you're going to see abdominal pains and chest pains. You're going to see some chronic conditions. So you have to know that emergency medicine isn't always trauma, or exciting stuff. You're actually doing a lot of medical stuff, sort of like internal medicine type stuff when you're in the emergency room. And we do a lot of primary care. You know, in this country, unfortunately, the access to healthcare is not that great. And so a lot of patients, the only place they have is the emergency room. So they'll come to the ER for blood pressure management, they'll come for diabetes management, and so you're it for that person. So your role as an emergency room doctor in primary care is actually really important, because you are the only doctor that person has access to. So your role in the community is extremely important. And then most patients that we see in the ER, they come to the ER because they think they're having a life-threatening emergency, but thank goodness they're actually, most of them are not. They're having chest pain, but it's not a heart attack. They're having abdominal pain, but it's not an appendicitis or something else life-threatening. So, but you're there to rule that out, and you're there to reassure them, and you're there to give them the appropriate diagnosis, and then give them the appropriate follow-up. Now, there's a difference between emergency room doctors, or your practice of emergency medicine is going to sort of vary depending on where you're working. So if you're working at a big trauma center like County USC Medical Center, you're going to be seeing, like I said, all the trauma plus everything else. I don't work at a trauma center anymore, so I'm actually not seeing any major trauma. I'm only seeing, you know, heart attacks and strokes and asthma and things like that, which patients get very sick with those conditions, but we're not seeing the gunshot wounds and the stabbings and the major car accidents with internal injuries and things like that. If you're working in rural America, where, you know, you are the only hospital and the nearest trauma center is like 50 miles away, then you're it. And that burr hole I was talking to you about, that's going to be something that you're going to end up doing, because that person will show up at your doorstep, and there's no neurosurgeon, and you can't quickly get them enough to a facility where there is one, so you have to do something to temporize them so that they don't die. So the practice of emergency medicine will sort of depend on where you're working in the country and what kind of facility you're working at. So what personality types are best for a career in medicine or emergency medicine? So when I was in high school, like I said, I decided I wanted to become a doctor when I was a sophomore. And so when I was in a junior in high school, our English teacher gave us these personality tests, right? You answer all these questions about your, you know, this and that, and they give you this personality. You know, your personality is blah, blah, blah. It was called a Myers-Briggs. I don't know, my husband took it too. And so along with your designated personality came this list of professions. You know, these professions are best suited for your personality. And so doctor was not on my list. So I was really upset and confused and disappointed, and I thought, you know, gosh, does this mean I'm not going to be a good doctor? Or what does this mean exactly? So I'm here to tell you, after 20 years of practicing medicine, it doesn't matter what your personality is. You can, if you're really quiet and shy, or you're really extroverted, everyone is going to thrive within the field of medicine. So if you ever have a counselor give you a personality test, say, no thank you, I've already decided what I want to do with my life. So please don't let that limit you. I kind of had a little freak out moment when I was in high school. I don't want you guys to go through that. So how much money do doctors make?
Fireworks?
$267,000. That's just median income for emergency room doctors. So it varies tremendously depending on where you're practicing. So the road to becoming an ER doctor. So of course, obviously, you guys are starting out right in the right spot, which is that you are in high school and you need to graduate from high school. There's no getting around graduating from high school, okay? So everybody just Now you need to attend college. Now notice I didn't say you need to graduate from college. I am a college dropout. I dropped out of college when I was after my 3rd year of college. So I never got an undergraduate bachelor's degree. The reason I dropped out of college was because I got into medical school a year early. I don't know if you guys know, but things have changed since I've been in medical school. But there are still universities in this country where you do not need to graduate from college. You do not need your bachelor's degree. You just need a minimum of 3 years of college, plus all the prerequisite courses to matriculate into medical school. So I kind of created my own fast track to medical school, and you can too, but you need to be an outstanding student. And by outstanding, I mean you need to stand out from the crowd. You need to do some things that make you, or separate you from the pack, if you will, because obviously a lot of people apply to medical school. Now, if you don't want to do the Elizabeth method, there are other more traditional methods. There are accelerated programs, a lot of accelerated programs. Look at that, and these are 6 and 7 year programs. Here's 7-year programs, and the way these work is you actually apply to medical school from high school. So those of you who raised your hand that you want to go to medical school, guess what? You could actually apply to medical school, not now, but in a couple years from now. So the way these programs work is that you get into a combined bachelor's and medical degree. So the 7-year programs are that you're going to do 3 years of undergraduate, 4 years of medical school. The 6-year program is going to be 2 years undergraduate, 4 years of medical school. The bonus to this is that you're in. That's it. You're done out of high school. I mean, how amazing is that? If that's really what you know, what you want to do. There are some little, secrets to this, which is that you have to have a minimum GPA. You have to maintain a minimum GPA. Some programs is kind of split through the middle. Some require that you do take this medical school admissions test and have a minimum score. Others actually don't make you take it at all. So if it's something you're interested in, you can save yourself a lot of money, because tuition in college, you guys have all these signs out. You know what the tuition is for college. You can actually save yourself some money. Not only money, but time, and then you're now a year or two closer to your goal of becoming a physician, which is fantastic. They also have 8-year programs, which the only benefit, you're not saving time or money, but the benefit obviously is that you're in out of high school. So that's in my opinion, that's huge. When I was applying to medical school, they didn't have these many programs. They literally had a handful of them, and I didn't apply. I created my own program. So once you get to medical school, you spend 2 years doing basic sciences. You're doing biochemistry and organic chemistry and stuff like that. And then the last 2 years, you're doing clinical clerkships, which are a lot of fun because you get to put on this little white coat and you get to go to the hospital. You're actually seeing patients. You're examining patients. It's the fun part of medical school. And then after medical school, you actually have to pick a residency program. So you can't just graduate from medical school and start practicing medicine. You actually have to pick something, family medicine, internal medicine, whatever. But of course, I know you're all going to choose emergency medicine because you know how exciting it is. And so the emergency medicine residency programs vary between 3 and 4 years. I did a 3-year program because I thought, well, why would I spend another year just making a resident salary when I'd be making a lot more money? And when you're a resident, that's really where you learn how to become an ER doctor. You work in the emergency room with a sort of a supervising doctor, so you're seeing patients. Once you see your patient, you present that patient to your attending physician, and then you come up with a plan on how to treat that patient. You're also, however, not just working in the ER, but you're also spending time doing general surgery, trauma surgery, pediatrics, so you're actually working alongside pediatricians, surgeons, so that you know exactly what to do when you're finished with your residency and you're working in the hospital. So trust me, I'm a doctor. Any questions? Yes, ma'am.
What's the most weird thing you saw?
Weird thing? So I was fairly fresh attending, working in the ER, and it was a community hospital, so we weren't a trauma center. We saw minor trauma, but not major trauma. And like I said, the paramedics are supposed to call you if they're bringing something in that's really bad, to give you a warning so you can set up. Well, it was a weekend morning, and they didn't call us. And again, frantic paramedics, and these were volunteer paramedics, they weren't career paramedics, bring in this kid who has a pole sticking out of his chest, okay? And it was a pole, a metal pole from a chain link fence. So what happened was they were all joyriding, these kids in their parents' car, and they went through this chain link fence, and as they hit the fence came through the car. He was sitting in the back seat. The pole actually impaled him. What side was it? This is left side. Impaled him right here in the side of the chest, and they came up through here. So they cut the pole and they bring the patient in. So you can imagine they're wheeling in this like stretcher, right, with this patient on the stretcher, and a pole sticking out of the patient. We're not a trauma center, so I almost lost my breakfast. And so anyway, we stabilized the patient. Thankfully, we had an amazing general surgeon who was on. I went to medical school with him, so we actually knew each other. He called in the vascular surgeon. We stabilized him in the ER, put some tubes into his chest. He luckily missed, most vital organs, but he did clip an artery and a vein that run right under the clavicle. So they took him to the operating room, fixed his injury, took the pole out, and he did great. So you really have to be ready for anything. And sometimes you get no warning, so. Yes, ma'am.
Have you ever seen a knife in the neck?
A knife in the neck? No, but I've seen, unfortunately, I've seen a lot of penetrating injuries, like stab wounds to different parts of the body. I'm trying to think if I ever saw one to the neck. I don't think I've ever seen one to the neck, but it's definitely not like still in there.
Okay, I have one more. Appendicitis, what's that? LOL.
Okay, so in appendicitis, we have this little, it looks almost like a worm that comes off of your intestines, and we don't need it. It serves no purpose. But sometimes it can get clogged, and when it gets clogged, it becomes infected, and if it becomes infected, it can burst. And then it can burst all this bacteria into your abdomen, causing really severe infection. So it needs to come out when it becomes infected.
Has anything ever come in that you didn't know how to approach?
There are things that come in that I don't know how to approach. Sure, all the time. And there are consultants a phone call away. So every emergency room will have a panel of specialists that are on call for the emergency room. And so if you have a patient that comes in with some problem that you're like, gosh, I really don't know what to do. Let's say it's a surgical problem or abdominal pain or something. You call your buddy, the surgeon. You say, hey, I have this patient and I need some guidance. Can you help me? And that's what their job is. They're on call. They're getting paid to be on call to give us help and guidance.
One last question, if anyone has one. Go ahead.
Oh, me?
No.
Yeah.
Oh, go ahead.
Okay. So for the emergency room, is the number still 911 or is it a different number?
Still 911.
More quickly. Did you have a question? You want to ask? Go ahead.
When you were in high school and you thought to be a doctor, what made you think about being a doctor?
So I loved, I was lucky. I was not as lucky as you guys in that you have this amazing school that, shows you what it's like to be a doctor or a nurse or anything in the healthcare field. But we had a class in physiology, which I loved. I was fascinated by the inner workings of human physiology, and I also wanted to just do good. How can I combine my two interests of like wanting to help society, do good things, but I also loved physiology. So I thought, wow, yeah, of course, medicine is the natural answer to fulfilling those two profound interests.
Oh.
How much money did you spend on school?
That's a great question. So, my dad paid for my medical school for me. My dad is one of those people who stuffs money under the mattress and will buy a car and keep it for 30 years. And so when he knew I wanted to become a doctor, he started saving. And he had a lot of years to save. And thankfully, he was able to actually pay for my medical school. College, they also actually paid for it because they saved from the time I was little. Yes.
How will you rate high school students these days? Now, unlike before, I'm sure during your time and probably during my time, If you ask an audience like this, all hands will be up. But you see, I go from school to school, and then they ask who wants to become a medical doctor. Very tiny percentage of the students raise up their hand. Why do you think that? Why do you think that trend is diminishing in terms of that desire to become a doctor? They want to become dancer. They want to become any other thing.
You know, I think, you know, social media has sort of hyped up the whole like celebrity thing, and I think that that's on a lot of kids' radars. It's just, you know, how can I, you know, become famous or be on TV, or the technology industry has really taken over too. And in our generation, technology is new, but these guys grow up with technology. So technology is very, I think, a very attractive career for them. So I think it's pulling away from probably a lot of different professions, technology, which is a completely new, you know, field. So that's the only thing I can surmise. I know that medical school applications are still extremely high, still extremely competitive to get into medical school, just like when I was applying. Yeah.
All right, everyone, let's give Dr. Marashi a big hand.
Oh, please. Oh, thank you. Thank you. Thank you.
All right, so have you guys stay for a moment? I know teachers, you guys have other classes. You guys can.
Yeah, I have two quick announcements for the students, but teachers, you all can go. Thank you so much. Bye.
Yes.